Just a short little clip to share some information about a case that we just saw. This particular patient is a kind of unique. He just turned 15 years old this past May. He is 6'6" and weighs 240 pounds, and he's still in 8th grade. But obviously he's pursuing a lot of athletics, and one of his favorite sports is baseball. He presented to the orthopedic office here locally, complaining of the medial elbow pain as well as knee pain, but they evaluated the elbow and they recommended that there was a ligament strain, and decided that the next best step for them was going to be, obviously, was going to be MRI, which, according to, once you see our findings here, he was not going to be a surgical candidate, so his next step would be physical therapy, which would involve stretching. And one of the things that I just researched recently online was that how can physical therapy help with a ligament defect or a partial thickness tear of a ligament? And the hypothesis is that by stretching that they will induce trauma or inflammation to the ligament and cause it to bleed and thereby make it heal. But the thing about ligaments is they have a very, very low vascular supply. So I don't know that that's really going to be the best choice. So this young man presented in the office with medial elbow pain, and he's a baseball pitcher, and obviously everybody's thinking already ulnar collateral ligament. And so we did that, but also one of our things about our treatment plans is that we want to be comprehensive and targeted. In other words, we're not going to focus just on the area of complaint. And so just let me show you in this next segment of the video the ultrasound findings and what our treatment plan was for this young man. So these are the diagnostic images, which are part of our standard elbow diagnostic exam. And this is an exam of the ulnar collateral ligament as well as the common flexor tendon. And what you'll see here where the two yellow arrows are the defects, the anechoic effects, or the partial thickness micro tears in the substance of the ulnar collateral ligament, and also effusion at the joint space, and also more significant strain/sprain of the UCL ligament that we see here. So again, this will lead us to a very targeted and specific treatment plan when we want to go treat this patient. But in addition to that, we looked also at the humeral-ulnar joint space, and the left joint space is on the left side of this split screen image, and the right joint space is on the right. Quite easy to see that there's also joint space effusion and problems within that small articulation there as well. All of these individual articulations in the elbow are a very important part of the normally functioning elbow, especially as this young man continues to move on in his athletic career and he wants to perform at a very high level. Lastly, we took a look at the lateral epicondyle, which nobody was talking about, and image on the left is the normal looking common extensor tendon and also the radiocollateral ligament that is deep to that. And then on the right you can see the abnormalities of the radiocollateral ligament here along this margin of the epicondyle. It's deep to the common extensor tendon, but also significant joint effusion within the radiocapitalar joint. So again, comprehensive targeted treatment plans, diagnosis and treatment with ultrasound guidance. That is always going to be the best choice, and the MRI is going to take more time, more money, and then take more time for this young man to get the treatment that he wants. So once again, MSK Masters, what we're all about is shortening the learning curve, showing you how to do the diagnostic imaging, and then to help you do guided, very specific injections.